Well, let me just very quickly then introduce, this is one of our Coffee Break with Grant series talks with Ryan Warren, who is directing ETI. Many of you know Ryan from being the master and jack of all trades for the college as the chief of operations, but he is formally, as per an email several months ago, moved over full-time to direct ETI. And ETI, for those of you who pay attention to CEHD Connects, I was looking at it again last night, in this featured section on Launchpad for Ideas at Work, quote, a new CEHD unit is speeding up the transmission of new knowledge and innovation to users and markets. And I'll just read one more sentence, because this is for me where it links our Office of Research and Policy with ETI and what the college is trying to build. Hi, Sue. Quote, it was a common problem. We were just about to talk about people that registered and didn't show, so you're good. You're part of the cool crowd now. Yeah. It was a common problem, period. Grant-supported research finds an effective solution to a challenge, and then the funding ends. So if we think of what we're trying to do to have an impact, and as broadly as we can and as deeply as we can, and the communities in which we serve and provide knowledge to improve outcomes, the idea to impact, I live in the recursive grant cycle world. When the grants end, I try to get another grant. And part of my impact is peer-reviewed publications and some collaboration. But if you think in a general RAND model, research and development, that development cycle within colleges of ed, at least, has not historically been something deliberately planned for. This ETI is an attempt to deliberately plan for that development cycle so an idea can get to impact in ways beyond our traditional. And so with that as a setup, I'll turn it over to Ryan, fill in the blank for his bowling name, Warren.
Washout.
I know it was washout. That's not a cool way to do washout.
Well, there you go. Thank you.
Thank you.
So to first just kind of frame ETI a little bit more, I think it's important for me to do that. But we had this concept of an ETI-like office in the college for quite a while. The problem that we were running into, and depending on how far back we go, it was a different version of the problem. But essentially it came around to this idea that we have a lot of knowledge in the college, and the ability to get that knowledge packaged in a way to get it outside of the college can be very difficult. And so we kept thinking about ways to do that, and not only to get the knowledge outside the college, but also to do it in a way that was sustaining. So to actually develop a revenue stream that would sustain the operations of doing that. And so Educational Technology Innovations, the genesis of that was the Institute for Design Innovation. I don't know if any of you recall hearing of that. IDI was how we first started. Classic university bureaucracy. Had a phone call from a colleague of mine in the College of Design who wanted to talk with me about the college's Institute for Design Innovation and why we thought that was an appropriate name for what it is we were trying to do. So we had some conversations, and eventually we came around to the idea of, you know what, we can rename this effort and make it more of a meaningful name to this college. And so after quite a while, we came up with this Educational Technology Innovations, or ETI, as we like to call it. So I hit on this a little bit, but ETI, it was not an idea, it was not an existing concept in the college for a long period of time. So IDI really was formed 4 years ago. And so ETI is in its 18-month of operation. And so when we formed ETI, we had to really make a choice to say that we need to do something different. It was not necessarily in the college's custom to have an R&D cycle. We do a lot of research, but we don't often do the development of a product from that research. And so ETI was really here and formed to do just that. So what we like to say is that what we do is we connect people with ideas and technology. And so we have people across the college, and everybody knows this. And we went through this exercise to say, all right, so what is it that we know that we have? And many of you know this, but we know that we have a lot of people and we have a lot of knowledge. So within this college, we have 7 departments, 3 college-wide centers, 180 tenure track faculty members conducting $44.2 million in sponsored research. So we know we have that. And our idea now is to connect those people and those ideas with the technology delivery system to get those ideas out the door. And so what we wanted to know is what if we had other people and other knowledge and other skill sets in the college and can connect this group with the other group. So let's create this innovation hub, which we think of ETI as an innovation hub. We hire software developers. So we don't hire people with deep discipline knowledge. That's all of you. That's what exists in the college already. But we hire people that can take that knowledge and work with you to create products and to create software and to create platforms that we currently aren't creating or weren't creating before ETI was formed. And we focus on dissemination. So we're not just building these tools for the sake of building the tools, but we also then have a strong focus on how do we sell what's built or how do we disseminate what's built in the case of some of the sponsored projects. And that we also said, can we do this? Can we build these products in the college and only focused on the college and not have this be a university enterprise-wide effort? And so after 18 months, we know that we can do this. We have 2 products that are currently launched and one that's in beta phase right now. So Press we launched in August of 2016. Dexalytics, which was content that came from the School of Kinesiology, we just launched that product in January. And Check and Connect, we're entering into beta sites currently. So in 18 months, we have 3 products that are leaving ETI's doors. Now, the first thing we do when we work with anybody, and some of you may recognize Check and Connect, maybe it's a different logo than what you're familiar with seeing, and so I'm going to hit on that a little bit. Press, the logo is also something different that we changed slightly, and then Dexalytics was brand new. But our focus is very strongly on branding. And part of the reason this is important is for this reason right here. Everybody, I think, knows this one. And some of you probably know this. Yeah? We got one in the back. Anybody know this? Oh, yeah. And now I'm going to stretch it. Not Marquette. Huh? The Rebs.
Oh, Mississippi.
Oh, Mississippi, yes.
Yeah.
But all you saw was an M. 4 different M's. So branding is very important. It's something that we don't typically think about or haven't typically thought about in the college is how do we brand the products that we're trying to build and then get that out the door. But we're here, so we'll talk about the big M. Check and Connect. So this is a new one, and I'm going to walk through this one a little bit, starting with the branding. So this is the logo right now with Check and Connect. What we did with that group is we started with what the logo was that they had. And we said, all right, let's start there, and let's just look at some different ways of maybe re-envisioning this presence that we have with Check and Connect. So we focused on the mortarboard, focused on the words check and connect, and we started to just kind of reframe that and rethink about this. All of this is done through us. So all of this is done in ETI before we do anything else. And then after giving these concepts, so we create these concepts, we send them back to the group that comes in, we have a discussion, and then eventually we land on the logo that everybody is happy with and the branding that everybody is happy with, which is this last one here on Check and Connect. So branding's great. It's nice to have a nice brand and have it be very sleek, but the other thing you have to do is then say, all right, so what is behind that? So what is the product, what is the tool that we are creating?
So I don't dispute the claims about the importance of branding, but that characterize that what you guys did as part of the branding process, but really what you did is you redid the logo.
Right.
That doesn't ensure a brand, does it?
Well, the logo is important.
The logo is important.
Yeah, I think the logo is very important. And it's also important from our standpoint, too, of starting where somebody is.
Yeah.
Right? And so Check and Connect isn't new. It's not like nobody's heard of Check and Connect. It's being used quite a bit in school systems all over the country. So they know Check and Connect. And we didn't want to move.
It has a brand already.
Right, it has a brand. And so we need to start there and just reshape that. You know, so it's not doing something completely different and saying, yeah, I know you called it Check and Connect for 25 years, but let's talk about this. Right? It's really saying, let's just rethink the way that we're positioning this brand in the marketplace. Because with this one, that's what we're doing. I mean, we're out, it's an external sale product, so we're out to generate external sales. We're against for-profit companies trying to do the same thing. We have a big advantage, in my mind, where we know it works and we have the evidence behind it. But still, we have to show that we're in the present-day modern marketplace. And so that's part of what we do and focus on. So at Check and Connect, this is now kind of the updated manual, but they've had this manual, and this was the distribution mechanism. The dissemination was this for a long, long time. Okay, so people could buy manuals. When they get the manuals, they go through the training. There's worksheets in here and things that will allow them to implement Check and Connect. But with the digital environment, we're able to capture this information and then display it back in different ways that they can't do with the paper manual. So we see this as a really powerful way, too, of focusing on talking to administrators. And so this is an administrator site. So you can see you purchase Check and Connect, you purchase this tool, you can log in and you can see how well it's being used, how often it's being used, whether it's being used the way it was intended to be used. So there really is a strong administrative component that we didn't have when it was this. There's also then this mentor profile with Check and Connect. So mentors are assigned students, and they check in with the students, they connect with the students in meaningful ways, and they can document all of this now online in the system rather than printing out copies of paper and sitting down with every student and doing it that way. So as we go through this, all of our build, all this that you see is built in a tool called Envision. And what Envision allows us to do is to build a tool and to make it functional to a user that's saying, all right, so if I'm a mentor, I can actually do things in the tool that will show me what a mentor will do in the software. And we sit down with the content owners and say, is this correct? So do we have this right? Okay, it's not a system where we bring something in and we say, we'll talk to you in 6 months after we build something. We're sitting down with the content owners, making sure that everything that's designed, everything that's built, does what they intended to do. So at the end of it, with Check and Connect, the other thing that they currently don't have at all in the manual is this student profile page, and that's something that they had heard, I think, quite a bit of what people want as they're implementing and using Check and Connect. It'd be nice to sit down with the student, identify where they are, where they want to be, where they need to be, whether or not they're on track. And so we can do new things that you can't do when you're looking at a paper system as well. So as I said, Check and Connect. Beta site's launching now. We're very excited about that. And what I want to do now is really just to get into that process piece a little bit more. So the first thing that we do in ETI is we use Amazon Web Servers for all the hosting, which is a more modern way of doing it and not relying on university infrastructure. What we don't want to do is have things on university infrastructure. They take down a server for an update, and now all of our stuff is down, and we don't have any way of bringing it back up. So we go with Amazon Web Servers, which is really what you're going to find more in those private for-profit companies. Also, as we get into security, one of the things that we found is that code repository can be missing sometimes. I don't know if anybody here has had experience with this, but we have talked with a researcher who hired a company to build an app for her. The company went out of business. The code was not in any sort of repository. So a repository allows you to access the code, to bring it back, and to host it on a different server. She wasn't able to do that, and so the whole product was gone when the company went under and had no means to recover the code. So we make sure that all the things we build is in a code repository that we would have access to, or you would have access to at any point in time. And then down here on sustainability and disseminate, everything we do, we're building with the intent of growing an audience. So we're not just building this, even if it's built to meet specific aims of a grant, we always have an eye towards, beyond that period, let's also disseminate this further. So let's plan on this being a product that we grow, and we'll talk with you about how we can do that. So the other thing that I want to just hit on a little bit is on this development cycle. There's really two different ways of developing these products. Waterfall, which is essentially where we would sit down with a researcher and say, tell us what you need. We're going to go away for 6 months or 12 months, and we'll come back and hope that we got it right. So we don't do that. That's a bad way. So really what we develop is this agile methodology. So that says that we're going to sit down, we're going to have an initiation, a project kickoff, and at that project kickoff, we're there with the software developers, we're there with the UI, UX, user interface, user experience designers, and we're there with everybody in ETI and ask you to bring everybody in your team so we can sit down and talk about what do you need? What are the features? What does this tool have to do? Let's capture as much of that as we can. Then we enter into these sprint sessions. So every 2 weeks, we're developing something in Envision, we're developing code, we're developing some dissemination plans, and we come back together every 2 weeks and we sit down and say, here's what we've done. Are we on the right track? Do we need to go a different direction? Validate what we've done, tell us what we need to do differently. And every 2 weeks, we're having that same conversation. So people will see, and when I turn this over to Piper, she can probably confirm this, if it's good, bad, or ugly, we show the code that we have. So people can say, yes, that's going the right direction, or no, it isn't. And we don't want to go too far down the wrong direction before we course correct. So the reason we do this methodology is to make sure that we're continuously talking with the researchers, with the product owners, so we know that we're building the right thing in the right way. The other thing that we focus on is mobile first. So in this day and age, and if we look ahead 5 years, I think continuously people are going to be accessing things on their phones, maybe tablets, much more than a laptop or certainly a desktop computer. So we design and we build as if it's going to be accessed mobile first. And then we just build up from there. And then one of the last things that I'm going to talk about before turning this over to Piper is that on our dissemination plans, we use a tool called ActiveCampaign. And so what ActiveCampaign allows us to do is create email templates. So you see 2 of these templates that we created through ActiveCampaign for Press. We create these email templates. We work with the product owners and the content owners on what content goes into these templates. And we have a regular schedule of communicating to our audiences or other audiences that we would get from attending conferences or as the list would grow. And we have targeted ways of growing that list as well. So with Press, they had an initial contact list of just under 2,300 individuals when we started working with them in August. And we developed a social marketing campaign strategy, did some other things with them, that now we have a list that is nearly 5,200 individuals. So in about 7 months, we grew that list pretty substantially. And that's our focus on dissemination. Of that list, over 1,500 are premium members or paying members of the content of the website. So all of those strategies, all of that dissemination planning, in addition to the software development, we lead and we manage and we work with you on through ETI. So I'm going to get a little bit more into sponsored projects, but before I do that, I'm going to turn this over to Piper Meyer. We're working with Piper on actually 2 projects, one of which is a sponsored project. So I asked her to come and talk from her perspective of her experiences in working with ETI and how that's gone. So I'll let her take it from here.
Thank you. My name is Piper Meyer.
I just switched you. Sorry.
Perfect. And I am a clinical psychologist by training, and I'm the executive director of the Minnesota Center for Clinical and Mental Health. And so basically, our center is funded on a number of different things. Excuse me just for a minute. Including grants and external sales. We do a lot of different things. So I was really interested in working with ETI for a couple of different reasons. I'm going to describe one project in particular, but I think that we saw the potential that ETI could really help us support ourselves on both the sponsored project end and the external sales end. So this is the sponsored project that you kind of see behind you. And let me give you a little bit of background so you can kind of see how this kind of developed and how we put it into the application for the contract. So one of the areas that I'm particularly familiar with is the development of early intervention programs for people with first episode psychosis. And so there's a lot of burgeoning research right now and has been overseas for some time. The US has really kind of been, there's a huge uptick in this right now. And the belief is the sooner that we can provide people services, the better outcomes they can have in the long run. So it's a lot around both education and early as treatment as possible. And so as a result of the US really kind of getting involved in this, every state in the union received some federal dollars in addition to their mental health block grant. And so the state of Minnesota had some money that they had acquired over about 3 years. They're going to get one more year, combined with some state dollars, and they put out a request for a proposal. They were interested in funding the support of some teams that would develop here in Minnesota, but also they were interested in funding an entity to do both the training and kind of fidelity evaluation and kind of help these teams grow and support themselves and find people to enroll in these programs. And that was the part that we applied for. And so this is an interesting issue because when you talk about kind of reaching kind of the first episode population and early intervention treatment, you usually think about it on two different fronts. One is the actual treatment component where you're training clinicians and you're trying to get out there and start programs, get people up and clinically trained and able to provide the one that we use is a team-based intervention that's kind of different interventions into one. But the other side is how do we get people that are more aware of what this is, what this looks like, how to recognize it, what to do if you recognize it. And that's often tasked as more as a kind of a public health campaign. And so when the feds sent down these dollars, they essentially said this has to be targeted for first episode psychosis, but they didn't put a lot of other restrictions on this. And so it's really been wide open to the states about how they use this. So when the request for proposal came down, one of the thoughts we had was that we could absolutely support the training and development of these teams as well as the evaluation, but very few states had really thought about the public health part. And is there a way that we could propose in our application a way to reach that more public health campaign component? So when we were putting together the proposal, we reached out to ETI and said, we're really interested in this idea of a public health campaign. What would it take to do an app that would essentially all of the teams could use whenever they were to go out and talk to people about referrals, when we were to go out and promote it, and that just across practitioners and family members and everyone else, we could promote as a way to educate the general public about what psychosis is, when does it develop, what does it look like, what do you do, who do you talk to, how do I get in touch with someone? And we went to them and said, we're kind of interested in this idea, what would it take? Would we have enough funding in this proposal to be able to support something like that? And so we went back and forth with one of the developers there and to get more information about this. And essentially they came down with a price that we could use to support within this sponsored project. So we included that, and it really rounded out our proposal because we were really able to say, for the first time, we're really thinking about this very thoughtfully. At the core piece, which is the training and the evaluation, we've got that covered, but in addition, within that budget, we can also support the public health campaign, which we think is really essential for these teams as well, and gives Minnesota a resource that can essentially live on past the funding, because this can live much longer and allow the education to be out there, as well as you'll see how to get access to these programs once they're fully operational. So the project did get funded, actually got funded at a lower rate, and then they actually came back to us and said we want to fund 3 teams, not 2 teams. Then we got the full amount that we asked for, which included the amount to build the app. And so we started out and kind of talking a little bit about what we were really interested in with their developers. And one of the first things that they wanted to do with us when we started meeting with them was to really come up with this branding idea. What are we going to call this? What are the colors that we're going to include in this app? What's the general feel that we're looking for? And when Ryan says it was kind of this process where we were checking in all the time, he's right. Because we went through a lot of this, and I was able to, they made it very easy for me to say, I've got some stakeholders that I can access, send this out, and get feedback about these things. So you can see here, you've got a couple of different screenshots from this. And a couple of things that we talked about a lot was, do we use kind of normal stock photos in this of real people, or do we go with more drawn faces? And there were pros and cons for those, and we went back and forth and we shared them with our different stakeholders to get feedback. Ultimately, we went with the drawn faces because we did want people to say, oh, that could be me. To not say, oh, it's only this one kind of a person that could be impacted by something like psychosis. That it could be any of us, and we could do a lot of different things with the faces to show diversity and difference and all kinds of a range of different things that could make this more accessible. And that's part of the reason that we went with the drawn faces. And so we really went through a lot of these really involved decisions to come up with what you're starting to see here. And it's not close to being done. I mean, we've got the last part, which is going to be on my staff's part, which is to get the content to put in there, the writing part, the stuff that you actually read, so that's the content part that we're going to have to put in. But a lot of the graphics are decided, I think the category of them, certainly if we have special sections we can get more, we've been talking about that, but in general you'll see the color palette is decided. We call this application, it's called We Can Navigate, because Navigate is the actual intervention that we're using in Minnesota, the evidence-based intervention that we're training the teams in. So we wanted to connect this with that name so people could understand that connection. So it's called We Can Navigate, which we also thought was very inviting and a way to kind of brand it so that it was accessible. And now we're this is kind of starting to refine, and we're starting to talk about putting in the content. And essentially what will happen is we'll have content that we talked about the different stakeholders that would be accessing this, which could include a person who's experiencing some symptoms. It could include a family member oftentimes that is curious about this, or it could include some sort of professional such as a researcher or a clinician that might be accessing this. And so we're going to put in information about the signs and symptoms and how to recognize those. Why is this, what might be different if you're looking at a first episode versus a multi-episode of schizophrenia. We'll put in what is an evidence-based program treatment for this. What should that look like? What are the common elements? How do they help people get back to recovery and move on with their lives? And what does that look like so that they know here's what you should be asking for and expecting in the treatment that you get. And then we'll put in some recovery stories in there so that they can see what other people say about their experience with this. And then lastly, Ryan sort of put on here, you can see, we'll have one of the things we were hoping for, which is like a geolocation factor. So the 3 teams that we're starting with, and I'm already getting more feedback about training more teams, so eventually I think we're going to have more than just 3 teams in Minnesota, as well as other ideas that are floating for the more rural areas. So this will grow. We'll be able to put in, here are 3 approved providers in Minnesota that have been trained in this model, that understand when you come to their facility about what to do about first episode psychosis. And here's a contact. Here's someone you can call right now and get some more information. So it really, hopefully, will shorten that time. If we think about public education, public health, this is that piece about really starting to make that connection as soon as possible. Whereas someone else who wouldn't have this information, it may take them to route this way and that. If you've ever tried to navigate the mental health system for the first time, it can be extremely overwhelming. And the thought was that if we could get the awareness up, that it would change that. And so ETI has really kind of helped us think along the way, each step about how we do this. Now some of it has been on this back end that I don't see any of, and I'm happy for that. I don't need to see the programming language. That is just fine if I don't need to see that. I just need to see if it works and be like one of those users that can test it out. And that's what we do in our calls every week, is whether we're talking about the color palette or the drawings or the graphics, or soon to be the content, but they also took care of not only the branding, but we had to come up with, we're actually going to use a mobile version of a website because it's easier for this to be hosted on a website. One of the things we went back and forth for a little while on is, how are the people who are going to most need this, how are they going to get to it? And if it's a true app, if you think about it, they actually have to go in and download it onto their phones. How many of us, that's an extra step for me. I know that sometimes I'll just avoid that. And what do? I get on my phone, pull up Safari, and Google it. That's how I find it. So we said, if that's going to be the way that's going to be most accessible, it might be really much a better idea to do kind of a mobilized website that's completely formatted so that when it shows up on somebody's phone, they look at it and it's as easy accessible. So we made several of these decisions so that we knew that we were going to best reach the audience and it could continue to be branded. We've started to think a little bit, or at least I have, about what happens after the sponsored project. We're funded for about 2.5 years and we're about 6 or so months into it. And the thing is that that model Navigate is actually used all over the country and actually outside of the country as well. So I think there's more potential outside of Minnesota. One of the things in our agreement is that Minnesota, by paying for it, automatically gets that free access. But outside of Minnesota, we really do have a lot of opportunities that we can continue to pursue and think about, because this is a national model. It's not just a Minnesota model. So there's a lot of potential there. But that's kind of been our experience. Was that what you're looking for?
Yeah.
Okay.
That's great. Thank you. So as you can see, even though they're drawn, I did pose for one of the. It was a bonus. So I'll just kind of, well, let me get this on first. So I'll just briefly go through some of the other projects that, one of which that was funded that we're building out now, and then one that wasn't, but just to give you a sense of the types of things that have come in the door and kind of what conversations we have with people. So this was one, MinLink. I think there's at least one person here that knows MinLink pretty well. So the idea on this project was that what they really wanted was, and it started with, we want researchers to be able to sit down at a desktop and pull up the linked information, the data that they need, much more easily than they can right now. And so the end part of that was where we had to get to, but before we got there, we had to talk about all of the different types of data that is MinLink, how that data needs to be separate, how it needs to be anonymized, how it also though needs to be connected, and prove that we then have a way of connecting that data, keeping it separate, keeping it anonymized, and eventually getting to an end place where somebody sitting down at a machine is pulling up and accessing the data that they need to access. So this was very different than I think what Piper described on, a mobilely responsive app that's out in the field. This is something that's really needing to be locked in, locked down with strong security behind it. And then the other one that is funded that we're building out now was, again, this kind of mobile first idea. And I think the screenshots that were up on We Can Navigate, you probably saw how that was designed for a phone. Those screens were designed for a phone. It wasn't designed for a screen like this, and now we need to suddenly shrink that for a phone. But we know that's how they're going to access it, and so we designed it that way. Same thing with this one. This was an app that needed SMS, the services, so the text messaging services, to trigger certain behaviors at a certain point in time, and also then deliver some video capabilities through that. So we try to manage all of the development in ETI that we can. So if there's video creation, we do that, or we outsource it. SMS is something that we can do, the data architecture, all of that is stuff that we can do. And what we tell people is don't assume we can't do it. Come to us, let's have the conversation, and we'll tell you that we can't do it if we can't do it. But first, let's make sure that we're at least having the conversation so you know what it is we can and can't do. So just real quickly, some of the things that I think would be good then for everybody to know. First of all, how we get written into these grants. So this has changed. We went through the arduous, which shouldn't have been arduous, but arduous process of becoming an approved ISO office here at the university. And so we have an hourly rate that we can then apply and be in on the grants in that way. So this rate that you see, there's a leadership rate and a development rate. Development rate is the cheaper one, the 115.67. Projects tend to be, it varies depending on what it is. Like a MinLink project would be more leadership than some of the development costs, but some of the other ones are more development. So generally we think it's probably typically going to be a 75-25 split, 75% on more like the development cost, and 25% more on the chief technology officer and other leadership capabilities. The other thing is that, and this is probably true for everybody that does anything with sponsored projects, time is our enemy eventually, but if we can get out in front of some of these things, let's make it our friend. And so the sooner we have the conversations, the sooner we know what it is that you're thinking about, the better it is for us. And part of that right now in our development is we have a full calendar and a full plate of projects that we're building out. And so we need to understand what it is you're doing, when likely it needs to be built. So I know a lot of these projects will span multiple years, and maybe there needs to be some knowledge and some evidence learned before we get to a tech development phase. So the sooner we have the conversations, then it's better for us to know, all right, how is that really going to slot out in terms of our calendar and when we have people freeing up and time freeing up. And then funding, it costs money to do this work. I wish it didn't. It takes time and it costs money. And I think that, and everything varies. And I hate to even throw out a number just because it's going to be hard to hold true to it. But to give you the low end and the high end on what we've done. So for every project that we've talked with people about this last year, the minimum amount of funding that we felt was necessary to do a project was $40,000. And so it was that just to do a very basic kind of effort. And then we were up into over $500,000 on a more complicated effort. So it's a wide range, and that's partly why we want to say time is our friend before it's our enemy. The sooner we can talk and understand what it is you need, the better it is for us to give you a real number and can be built into the projects. So the last thing before I throw my email up here is that we have not mastered this. So I don't want to pretend that we have, because we are doing something beyond what the college, I think, typically does, and for that matter, probably every other college of education and human development is out there. This product development focus and the technical development focus that we have is an opportunity for us to grow in ways that I think is really important for all of us, both just to meet the aims of a lot of the grants that are coming out, as well as developing a sustained funding source that we know is out there. But it is also very much in its infancy. We're 18 months into this in terms of who we have at the ETI. So come talk to us. Make sure we have enough time to be helpful, but also be patient is the message that I want to make sure you hear. And then last, please just reach out and contact me if you have any questions, if you have what you think may be some opportunities. We'd love to have the conversation, and if it's something that we're not suited for, we certainly will. We'll let you know that. But please reach out, and I'd be happy to talk with you about anything, both sponsored and non-sponsored types of projects. But mainly at this stage, we're really focused on the sponsored project opportunities. So with that, happy to answer any questions. In some cases, it may need to vary. I mean, typically what we want to do is use that ISO rate and kind of the internal consulting effort on the project. There are some cases where, and I think kind of the tipping point that some people would view is if there's new intellectual property that is being created through the effort, that we may need to go more of like a key personnel or another personnel in terms of getting written in, but we can leverage a lot of what we already have built, and so that becomes more that ISO function. And so that's where we think is the best place to start, is that ISO internal consulting. Right.
Is it work for hire, Ryan? You just talked about it being different if there's going to be new IP.
Well, we've not had that before. I mean, it could be. We're open just because, of kind of the 18-month existence. We don't know exactly what we're going to look like 5 years from now, right? But typically what we've done to date, well, across the board, is we viewed it as partnership. We viewed it as we're in this together, and part of what we bring to the table, even if people want it to be work for hire to start, I think eventually they realize they don't. And some of that has to do with the dissemination focus and the different ways that we utilize, like Active Campaign, and we have the ability to outsource some of the social media campaigns and do things that are hard for people to do. And we have a pretty cost-effective way of doing it. So when you kind of get into that level of work, it's not just software development, it really is more sales. And part of ETI and that the umbrella of ETI includes what's new to the college, the Center for Sales, Leadership, and Education, that Roy Gaddy is directing. And so that's bringing in opportunities for students, typically that go through OLPD, but also students that would be in Carlson, students across the university, and they have more of a sales focus. And so we've started the conversation about, well, if you have a sales focus over here and we're building tools that need to be sold over here, maybe we can figure this out in a way that provides great opportunities for students and reaches audiences we otherwise wouldn't reach in a very cost-effective manner. But if the desire is a work for hire kind of arrangement, then we'd certainly have that conversation. Well, don't hold me to it, but what I've thought about and kicked, what I've kicked around on that is that, and maybe some of this is that I'm thinking too grandiose about what this effort is, but on the low end, I'd say I would like us to be at least 50% funded through sponsored projects. I think it's important for the mission of the college that we have a place like ETI that we haven't had before that can do, and we've seen it. We've had the conversations with faculty members, researchers that hired a company, local company, spent $100,000 and got nothing out of it. And if we can do that same thing and have a functioning tool that's being disseminated and is in school districts with an evidence-based practice that's going out, that's important, and we want that to happen. So I'd like for us to at least be 50% funded from sponsored projects. The other half then needs to be revenue producing to cover our costs and revenue generating for units. And so today we've talked about it as 4 units. So like a press, Center for Reading Research, has that content, and so let's figure out, and we've figured out a budget scheme where it's basically as we cover all the costs to operate this, now there's money being produced that goes back into the center. And so that's the other measure, is that we want to be revenue producing, not only covering our costs, but also then additional revenues for units. And where I go a little bit more grandiose is I think that this is unique, and certainly in colleges of education and human development, and I would love for us to be able to recruit faculty to the college and say, you can do stuff here in this college that you can't do at your home institution. We have a means for you to be able to disseminate your work in ways that you can't do now. I think they're missing more the development phase. I think they have a way of commercializing the knowledge that's there, but they, from what I've seen, have not created a software development shop. And so really, and just kind of in terms of like maybe the industry term that's out there, it's a SaaS model, which is software as a service. And so that model would say that building the software is good and is important, but it really isn't useful unless we're also providing a service. So, for a Check and Connect, the software is good, but there's also the service of ICI being the content creators and the deep discipline knowledge of that, being there to offer trainings, offer workshops, provide services to them when they have questions. I think that's a really important place for us to be. And that's what I think is somewhat unique, is I don't think there's, from what I've seen, anybody that has a shop that really is a SaaS model designed to develop products from the knowledge that exists.
Can you speak to what makes you more cost effective than working with a local shop?
So our external rate is more kind of what would be like an industry standard. So the external rates, I show the ISO rate, the internal sales rate, but external rate that we have approved is $160 an hour up to $215, I think, which is more common from what you'd see. So I think the work certainly would be more expensive. The other thing we've seen is the deliverables aren't what people think they're going to be. And that's part of with this agile methodology. I think typically in some of the things that we've been aware of and places other people have used when they had a need for software to be developed, you'll have an initial meeting, and there may be another meeting that occurs, a few months after that. But this regular check-in, this 2-week interval check-in to make sure that what we're doing is going the right direction and it's clear that we're actually building the tool and we're not just building the specs that would then be us building the tool. You know, the deliverable were the specs, not the tool. So here, take the money and here's what you have. Now, if you want us to build it, that's going to be an additional, you know, 250 hours of work. So I think that our process, I mean, we can't go anywhere and hide, right? I mean, we're like right here in the college. Everybody knows where we are. Somebody has one bad experience, I think that's going to spread pretty quickly. So I think that, you know, one, the rate's lower, and in my mind, because we're in the college, I've been here 10 years, was, you know, in higher education 5 years before that. I think we tend to speak a little bit more and understand more about what people are needing, even if the communication isn't there. We probe, we ask the questions, we make sure that we know, all right, so what you're saying you need at the end of this is the following. And then we can say, all right, so here's what that's gonna cost. But I think all of that combined is really what makes us a better fit. Yeah.
Well, thank you very much.
Thank you. Yeah.
Thanks very much.
Thank you. Appreciate it.